Hello everyone, this is a quick guide on how to navigate this spreadsheet, which contains prevalence and incidence data for over 250 eye conditions grouped by subspecialty. So we first published this document in September 2024, and we hope it's particularly useful for clinicians, commissioners, operational managers in the NHS, and also those conducting academic research. So when you first open the document, you should land on this guide tab here, which explains what's in the document, how the information was gathered, and how best to navigate it. So if we look at the how do I navigate this document heading here, we can see that it points to the index sheet, which provides an overview of all the conditions that are included and hyperlinks so that you can navigate directly to specific eye conditions. So the document also provides estimates of the number of required attendances for each condition and also the composition of the optimum MDT workforce, which is explained here. So if we go to this index tab, we can see that each eye condition is grouped by one of 14 special interest areas, which are listed in alphabetical order. So we've got everything from cornea all the way down to uveitis. So let's say we want to look at a particular eye condition, let's say strabismus, for argument's sake. So you can see here we land on strabismus. You can see there's prevalence data for strabismus. So our expert working group here have identified 3 studies, which each have a PubMed reference, which you can look into. They then estimate the number of visits to make a diagnosis for this condition, the percentage of incorrect referrals, and then the number of required attendances in the first year, and then in years 2 to 5. So if we then navigate back to the index, so another approach you might want to take is you might want to look at data in we might want to look at all eye conditions in a particular special interest area. So let's look at cornea, which has the best part of 20 eye conditions. So if we click on the first one, we will see that each eye condition has this data in a relatively uniform way. So we can scroll across and see each condition, whether there's incidence or prevalence data or both, what the population for the data is, whether it's UK, global, or another population. So for example, we have Colombia here, and then what the reference is as well. So you can scroll across and see all of these different eye conditions. So if we go back to the guide, there's one other thing that I think would be useful to highlight here. So we also asked each expert working group to determine what the optimum MDT workforce is, as I said at the start. And that's in terms of a clinical session in their subspecialty. So we hope this is really useful, especially for those who are involved in planning services. So if we open that tab, we can see, well, there's all of the 14 special interest areas here. And if we take just one as an example, let's take glaucoma. So each of these expert working groups was asked to determine for each of the kind of workforce groups which roles were essential, i.e. the service can't run without these people, required, which means they would make the service more effective, or desirable, which means they would optimize the service. So if we just start looking at glaucoma, we can see that our expert working group said a consultant ophthalmologist was essential, a SAS ophthalmologist was required, a trainee who subspecialized in glaucoma was required, another trainee who wasn't specializing in glaucoma was required, an academic ophthalmologist was desirable, a clinical fellow was required, a community ophthalmologist was desirable. And then it goes across to the optometrist workforce group, where for glaucoma, they've said a hospital-based optometrist who specializes in glaucoma is essential. A hospital optometrist who isn't specializing in glaucoma is desirable. A community-based optometrist is required. And then there's another workforce group, which is nurses, where, again, a hospital-based nurse who specializes in glaucoma is essential. One who doesn't specialize in glaucoma is also essential, and a community-based nurse is desirable. Now, I'm not going to go through all of these workforce groups because it would take a long time, but you can see we have the same approach for orthoptists, ophthalmic and other allied professions, other doctors, other support services, specialized services, and joint ophthalmic clinics. So I'll take you back to the guide page just to round up. So we hope this is a really useful resource for everyone. I think particular thanks has to go to all the people who helped with the expert working groups, and you can see their names there. They dedicated a lot of time to collating all of this information. And the last thing to say really is we aim to keep this a living document. So please do tell us if you notice anything that should be added or amended. And the best way to do that is by contacting Professor Stephen Kay, who's our vice president. You can contact him on this email here, stephen.kay@rcoph.ac.uk. Thank you.